I'm Brian Murray. I'm a urologist here in Albany. I work in Capital Region Urology. It ranges from medical management of diseases like prostate, kidney stones, bladder cancer, and incontinence, all the way through the most complicated surgical management of those diseases. It's a big demand just because of the population, that there's a pediatric population to it, but essentially if you live long enough as a male or female, you're going to develop a urologic problem that probably needs some attention. The most bothersome symptoms for people, along with just having leakage of urine or incontinence, is the urgency to have to go. So they get a sensation that they really need to go, and they even just can't control it, or it starts disrupting their life. I have patients who they have to stop 6 times on the way to New York or Buffalo, or they know where every clean bathroom is. The problem is people think that it's a part of aging, and they don't also understand the other implications of it. And typically when it gets bothersome enough, they will deal with it. The part of the problem with incontinence in this country is you've got all these commercials on the television that have convinced people that living in diapers and pads is socially normal and that's what they should do. And so there's statistics that show for every 1 woman who comes to a doctor about her incontinence, there's between 9 and 11 women who are just using diapers and just happy to do that. And you fix that and they go back to a normal life. And the answer is they usually go back and tell their friends that they've had the surgery and did well with it. And next thing you know, I've operated on almost a whole office at the state after operating on 1 woman with incontinence. You'll get 1 person in and you treat it, and they're like, I'm gonna tell my mom or tell my sister, because they have the same problem, but they just didn't think there was anything to do about it. One of the first women that I did a urethral sling on was a kickboxing instructor, and that was probably 17 years ago. And she is probably still one of my largest single referral sources, because she tells me when I see women in my class get that look on their face that she used to have, and it's funny, but at the same time, that these women are all going to class, trying to exercise, and most of them have changed what they're doing because of the incontinence, but they don't want to admit it. And when they finally realize that they don't have to do that, and there's something you can do about it, it does make a huge difference in their quality of life.